My name is Victoria Wiggins, and I'm presenting on musculoskeletal disorders.
This presentation covers the definition of these disorders, their symptoms, diagnosis, what risk factors there are, treatment options, and the most promising new treatment emerging in the field.
A musculoskeletal disorder is any injury or disorder that affects the body's ability to move. This can be caused by affected bones, joints, tendons, or muscles. Some of the most common and well-known disorders are carpal tunnel, which occurs from the pinching of a nerve in the wrist, degenerative disc disease, where the cartilage between your vertebrae begins to erode, tendonitis, sometimes referred to as tennis elbow, trigger finger, and fibromyalgia, which affects multiple parts of the musculoskeletal system and can make sleeping nearly impossible. The symptoms of musculoskeletal disorders are pain, which can range from moderate to severe, most often described as sharp or stabbing, tingling, swelling of the joints, stiffness, a burning sensation in the joints or muscles, and fatigue. Diagnosing musculoskeletal disorders can be difficult, and they often go misdiagnosed because the symptoms mimic those of other diseases. The only way to correctly diagnose a musculoskeletal disorder is through a combination of evaluation and testing. Evaluation includes determining which groups of connective tissues are affected, how long the pain has lasted, and if any other organ systems are involved as well. Testing ranges all the way from simple blood tests, which aid only after evaluation, to MRI, which can identify abnormalities in soft tissues such as muscles or ligaments. The risk factors for developing a musculoskeletal disorder can be separated into two categories: work-related, also called ergonomic, and individual factors. Work-related risk factors include posture and movement, which is having your body and neck in either a fixed or stressful and awkward position for extended periods of time. Repetitiveness of the task, such as working on an assembly line, repeating the same few motions over and over again. Even typing can be considered a repetitive motion. Pace is a factor as well. Fast-paced work leaves very little or even no time to rest. Force, if your work requires you to apply a great amount of force or pressure on something, it can cause muscle fatigue much more quickly than less laborious jobs do. Vibration is the final work-related risk. Vibrations from machinery can cause a lack of control of the limbs, leading to injury, or can cause numbness in them as well, negatively impacting their function. Individual factors are poor health habits such as smoking, drinking, or binge eating, lack of sleep or adequate recovery time. When you don't allow your body the appropriate amount of time to heal, you're far more likely to re-injure yourself or worsen an already existing injury. Finally, and we should all know this, poor diet and not drinking enough water contributes greatly to injury, especially musculoskeletal ones. And, as the National Institute for Occupational Safety and Health says, the best way to prevent musculoskeletal disorders is to avoid as many risk factors from both categories as possible. Common treatment for these disorders are medication, such as anti-inflammatories or NSAIDs, serotonin inhibitors, which can aid in pain management and insomnia, and finally, opioid pain medication. Physical therapy is another option, as is osteopathic manipulation, which involves the manual manipulation of muscle and bones. And the very last option is surgery. The newest form of treatment gaining recognition in the medical field is called gene therapy. Initially, gene therapy was focused only on treating arthritis patients, but is now branching out to treat other disorders as well. Gene therapy introduces healthy genes into tissue cells in order to replace damaged or mutated genes. This can allow tissue to regrow or reinvigorate. The procedure can be done either inside or outside of the body, also known as in vivo or ex vivo. The ex vivo version takes healthy genes and inserts them into a previously taken sample of the patient's tissue before the new, enhanced sample is reintroduced into the body. One of the most exciting aspects of gene therapy is not that it can treat more than arthritis, but it has been effective in the treatment of both injuries and genetic disorders. While still undergoing clinical trials, gene therapy has produced wonderful results, showing itself to be more effective than surgery, with patients experiencing improvement at a minimum of 2 weeks longer than after traditional surgery. The procedure is less invasive, no tissue or bone needs to be surgically removed, and the insertion of the new genes occurs through small incisions that leave minimal scarring. Because of this, patients experience far less downtime, their body healing quickly and allowing them to leave the hospital sooner, and with only basic aftercare instructions. Finally, the cost of gene therapy is typically less expensive, making it available to more patients. In conclusion, musculoskeletal disorders can be painful and debilitating, but there are prevention methods and treatment options available. The recent advancements in gene therapy show promising results for finding a better way to treat those most affected. Once again, I'm Victoria Wiggins, and thank you for your time.